You'll be able to identify our hub members, other than a few that were having difficulty getting their backgrounds to work, and I'll have them wave to you when we get to them, but you see all of our hub members have the background just like I do, with the ECHO logo as well as our Project Scope logo. So what are we going to be talking about? Oh, so here's our hub team. So as I said, there's myself and Stephanie Weber. We also have Elsie Bush, who is an occupational therapist on our team. We have Michelle Raleigh-Roberts, who is a licensed clinical psychologist and is one of our trauma experts, as well as expert in developmental disabilities. John Kinsel, who's an infant and early childhood mental health trainer and consultant. Kristen Kerwin and Stacy Lee are nurse navigators from Ohio University that work with expectant moms with substance use disorder. We have Stacy with us today. We'll have some other of the nurse navigators joining us. Aaliyah Keeley is a developmental specialist that works at The Ohio State University. We have Michelle Hendricks, who is, was a foster mom, now is an adoptive mom and an advocate. We have Kathy Krebs, another occupational therapist. Amber Clark, who's a licensed social worker. Leslie Razor Becker, who's a speech and language pathologist. Kathy Wettig, who is a neonatologist. Troy Hunter, who is a developmental specialist and social worker. And Pam Williams-Aria, our developmental behavioral pediatrician. So you can see we've got a hub that has a lot of different expertise that we hope to be able to share with you, both with our didactic sessions as well as during those cases, to help talk through some of those challenges that you all are having. So just to talk to you guys a little bit about our sessions. We have session 1, as I said, this can just give you a little bit of framing. Next, our next session will be on neonatal abstinence syndrome, where Dr. Kathy Wettig will give us a background there. We have Dr. Cassie Horseman and Dr. Mike Walensky, who are going to be talking about addiction and treatment and give us a background in all of those pieces. Then we have myself and Steph Weber, who will talk about developmental monitoring. And then John Kinsel, who is our awesome infant and mental health specialist and our nurse navigators, will talk about having difficult conversations with families. The next 4 sessions that we'll have are related largely to trauma. So understanding trauma and how it intersects with substance use disorder, as well as giving everybody some tips in how to address them, how they impact development and all those pieces. And then we'll wrap up at the end talking about models of care and just wrapping up our scope and talking about what we've been doing over the course of the 8 weeks. I see a question, will the slides be emailed to you? One of the other things that you will get as a part of your participation in this ECHO is you'll get access to our Canvas course, which will have all of the handouts and slides, as well as a recording of this session. You should get a PDF of the slides that should have been emailed to you this morning, so check your email and check your junk mail if you haven't seen those. And if not, we can always make sure to get them to you. But the course where you'll get the information, I encourage all of you to enroll in that course, because it's going to be very helpful in getting that information and having access to all of the handouts, the videos, the links, and all of those pieces. Yes, will all sessions be from 9:30 to 11? Yes, that what we found is that gives us time to be able to give you the didactics and then also to have the case discussion. And for the credit, we'd like you to all be there for that. So just looking at the agenda for today, you'll see I have approximately 2 more minutes to go over the agenda with you before we're going to get started. Then we will have Dr. Kathy Wettig, who is going to give us our first presentation to talk about self-reflective practice, not enough coffee this morning, and self-care techniques. And then what we will do is we'll do breakout rooms. So the participation is part of that ECHO. So what we'll do in this first breakout room is just have you all introduce yourselves, talk about your role, and then give us, just have one talking point, whether it be related to the talk or why you're joining our SCOPE ECHO project. Then we'll have Dr. Stephanie Weber, who's going to talk to us about just giving some framing on the opioid crisis and how social determinants of health impact those. Finally, what we'll do is spend a little bit of time. I've been talking about cases. I'm going to keep talking about cases, and Dr. Weber is going to help me talk about cases. She's going to talk a little bit about what a case presentation would look like and wrap up, answer any questions. After all of these, we'll pause and have time for questions. So I see a request, you can do separate sessions and get credit. Yes, we understand that being able to commit to all 8 sessions is challenging. And so you'll get credit for whatever sessions you do attend. But as we said, our plea is just that you will hopefully join for the whole session, because it's really through this collaborative of all of us learning together that we're going to be able to really affect the most change and get that impact that we're trying to get with ECHO. Okay, and I see a question about not being able to attend the course. So there are, there's recordings that you can view. Unfortunately for this, it's a live session, and right now we are only running the one session from 9:30 to 11. Okay, with that, it is my pleasure, and we'll be sure we can chat some other questions as we go through, but I would like to introduce Mary Vicario. Mary Vicario is a certified trauma specialist and holds a certificate in traumatic studies from the Child Trauma Center at the Justice Resource Institute. She trains nationally and internationally and has over 30 years experience working with survivors, turning the latest research into interventions for all ages and abilities. She receives ongoing trainings at international trauma conferences and the Harvard Medical School. Each day, Mary's father asked her, "What did you do today to make the world a better place?" She hopes her audiences leave knowing one more way they can do just that. With that, I'm going to turn it over to Mary.
Hello, everyone. Thank you so much for having me today, Project Scope and Project ECHO. It's always a joy when I get to join all of you. So while we're waiting for that to happen, we can do our first self-care technique, which is just noticing your breath. So just everyone take a minute and notice your breath. Don't have to change it. Just notice it. And while you're noticing your breath, see if you can notice any sounds that are around you. Notice any sounds. And while we're noticing sound, let's just take a minute and notice any light. Notice anything that's coming into your brain as light. And also now, let's just take a moment and let smell fill our awareness. And now we'll allow taste to fill our awareness. And see if you can feel the air against your skin, or maybe your clothes gently resting on your skin, or your hair resting on your face or neck. And now I'd like you to picture a light, beautiful light, and that light can come from any direction and any source. And just notice it warming and relaxing you from the top of your head through your shoulders and arms, all the way down to your hips and legs to the very tips of your toes. Notice yourself surrounded by safe, calm, healing light. And while we are surrounded by this beautiful, safe, calm, healing light, just take a moment and notice any 3 gratitudes that you have. And if you'd like, you can touch your fingers together as you name them. And throughout the day or the next week or month or so, whenever you need to return to this feeling of safe, calm, healing light, in a moment's notice, just touch those 3 fingers together, and the feeling of those gratitudes will come right back to you. You won't even have to consciously think about it. It will be right there. And as you are ready, just notice your breath again. And as I slowly count back from 3, we can re-enter the room. 3, 2, 1. Wonderful. Thank you, everyone, for going on that little trip with me. We just did a little grounding, and we'll look at how grounding can help us with our self-care techniques. So I want to help all of you put your oxygen mask on first, because you are working at 30,000 feet with children and families who have gone through so much, and we're all working under the stress of a pandemic. And when we get to our fear cascade, we'll find out why the stress in this pandemic is actually something that goes against our most basic drive for safety, for felt safety. That's me. More about me. I have nothing to disclose at this time. All right. So by the end of this session, I hope you're able to experience, not just understand in your head, but experience in your body the basic tenets of trauma-informed practices related to your own self-care. I love starting with this image of a baby in the NICU, in the neonatal intensive care unit, and a woman who volunteers at the unit to play guitar for the children. And you'll see the baby doesn't even have her eyes open. She's not even facing the young woman playing guitar. But this music is having an impact on some of the most basic parts of her brain. And actually it's occurring at such a young age that whenever she hears guitar music, her body will return to this feeling of calm. And this happens because connection is our greatest human need, and disconnection is our greatest fear. So if you leave with nothing else but this one sentence, it will change the way you take care of yourself and the way you take care of all those you are lucky enough to serve, and they are so lucky to have you in their lives. So let's start just by strengthening our roots and our wings. We all have them. And our wings are the things that lift us up and give us energy, the things that literally help us get out of bed in the morning. And then our roots are the things that ground us and calm us and can actually help us calm down after either a frightening or an exciting event. Because guess what? Our brain has a hard time telling excitement from fear, which is kind of the trick behind roller coasters. We should actually be scared out of our minds on roller coasters, but we're laughing usually at the same time. That's our brain trying to figure out, are we scared? Are we excited? Oh, let's just be both at the same time. So just take a minute, and once again, I'm going to have you name 3 things that give you energy. Just name them to yourself. And if you'd like, once again, you're more than welcome to touch your fingers together as you name those 3 things that give you energy and give you life. Now we're going to take a second and name 3 things to yourself that ground you. And if you could picture these things and even consider what it smells like or what else is happening, is the more you get your senses involved, the more your body relaxes. So we're going to think of 3 things that ground us and help us calm, feel settled and connected. All right, those are your roots and wings. When I do them with children, we actually draw trees, and we have many classrooms and preschool settings where they're up all around the room. Now just take a moment and notice, who are your supports? Because we go through life getting through the day, and sometimes we don't stop to notice our gratitudes. Who's there supporting us? What's giving us energy? What's helping us calm? So I just wanted to share this slide with you because whenever you need a break in the moment, if you just recall the people, the beings, the belief systems that support you, your brain will calm in that moment. And all of this is happening because our brain and our body and our actions, so our brain, our body, and our behavior are connected. In fact, they're so connected that all behavior is purposeful. That may be the only sentence that Sigmund Freud and I agree on, but it is true. No behavior is random. If it appears random, that just means we haven't figured out what it's trying to tell us. I am the me you have given me is another important piece of understanding how our brain, body, and behavior work together. Think about how you knew what you looked like this morning before you got up to come to work, or before you got up to get on this Zoom call where we get to have our cameras on. Was it possibly a mirror, or maybe someone in your home that let you know what you looked like? Yes, because we only know ourselves through our own reflection. We can't step outside of ourselves to see ourselves. Well, neuroscience shows us that our brain develops by and for the information given back to us about us. So every single one of us truly are who we are because of what's been reflected back to us. And I know that part of the work of the ECHO Project and Project Scope is to help you mirror back to the children and family you serve their strengths and the best that they have to offer and the resilience that keeps them going through difficult times. And all this works because as our brain is forming, it's waiting for the world to show it how to structure itself. We're the only creatures on this planet where 50% of our brain is developed after we are born, and it is developed by and for the environment in which we find ourselves so that we can adapt to that environment. But if you think of children affected by the opioid epidemic, then those children are impacted by an environment impacted by opioids. And in that environment, they need to be a certain way to survive. But when they're outside that environment, those survival skills can often cause challenges because they're not only not needed in this new environment, they can be disruptive. But understanding that this is a survival skill will allow you to identify what's the resilience behind that survival skill, and that's what you connect with in the new environment. And we can do the same thing with ourselves. When you do something that makes you not happy with yourself, and we all do it, what would it look like if instead of criticizing yourself, you just stopped and said, I wonder in what environment that used to be helpful to me, and honor that skill for helping you in that environment, and then see, what does my new environment need instead? And all of this occurs because we are dependent on one another for access to resources. Unlike these lovely little cute alligators, we don't have everything we need when we are born. We need all of what we need to survive needs to come from other humans. And so our life beliefs get caught up in that, our developmental milestones get tied into that, and our brain development gets tied into that. Even our ability to take in calories. One of the things Lou Cozolino's research is showing is that infants will actually reverse the part of their brain that tells them they're safe and unsafe, so that they can connect to caregivers or whomever they need to connect to in unsafe environments, so that their body will hold the calories that it takes in. Because without human touch, the calories we eat don't stick to our body. So some humans have to accept negative touch, like physical abuse or sexual abuse or other violent acts, just so their body will hold calories on it. And if you've had to do that as you were young, your brain has reversed itself, and you may feel safe in unsafe environments or when there's a lot of chaos happening, or you may feel unsafe in calmer environments. But we can all reverse that. That's the beauty of our brain. It keeps growing till the day we die. So we're going to give you some ways that you can reverse that for yourselves and for those you serve. And that's because for all of us to grow, we need to feel safe, which is different than being safe. I bet the children you serve are absolutely safe in your care. But sometimes they don't feel safe, and then they engage in behaviors that can be very frightening or disturbing. Know that we're going to work with you on how to help them feel safe in your environment, because we all need to feel safe, feel connected, and feel empowered. And Becky Bailey is going to talk to us a moment about how we can do that.
I Love You rituals are designed to build bonds between people so that each person in the interaction feels a sense of connection. Connection with parents, connection with teachers, and connection between children. This sense of connection creates a biochemistry that optimizes the function of our brain. What a wonderful child you are. The big bright eyes, nice round cheek.
Just love that video. So when you think back on that video, there was one part of that song that the child was really, really looking forward to. And you could tell because she jumped ahead and she pulled on her cheeks. That is called, science calls it a unique eliciting behavior. Fancy name, unimportant. What it is, it's the bonding center of her brain connecting with the bonding center of her parents' brain. So her and her dad were connecting through that pinching of the cheek. They connected through the whole song, but when there's an action that is mimicked by one person and then the other, it allows for extra connection, extra felt safety, extra regulation. And I bet all of you have a special greeting or a special something with each one of the children you serve. Notice what that is. And our goal is to switch the question from the uninformed question of what's wrong with you to the trauma-informed question of what may have happened to you, and then to the trauma-responsive question of what did you do to survive? Because in those survival skills is the hidden resilience people need to move beyond their traumatic experiences. And all of this works because we have these cool things in our brains called mirror neurons. And they are there to help us understand the actions, intentions, and emotions of others. Our mirror neurons in our brain allow us to grasp the minds of others, not through reasoning, but through direct stimulation, by feeling, not thinking. So we don't have to think how other people are feeling, we feel it. So all day you are feeling the feelings of the children that you are serving. And so we want to make sure we're doing things to help you clear your mirror neurons so you don't bring those feelings of stress and pain home with you. That's the bad news. The good news is when you bring joy into their lives, you're feeling that joy as well, and they're feeling it from you. And so I'm Italian, you can tell I'm already talking with my hands. So I'm going to teach you a hand brain because I'm going to be using it throughout the presentation. So if your hand was a brain, between your wrist and your elbow here would be your vagus nerve. Once again, a fancy name that's unimportant. What's important is that it runs the length of your spinal column and it connects with every organ in your body. And this nerve's job is to send your feelings to every organ in your body. And when Stephen Porges discovered this in 2010, he also discovered that it is those feelings we get in our body that actually drive our actions, which is why we started with our roots and our wings, because our wings are giving us, through this nerve, feelings that energize us, and our roots are giving us feelings that calm us. And it's important to know what gives us each feeling, because it will drive our actions. The next part of our brain is our brain stem. It's the palm of our hand. And the brain stem is in charge of everything we don't want to have to think about, like breathing, digesting, arousal, which could include staying awake during my boring neuroscience lecture right now, or the arousal that makes you want to do things far more interesting than be in this room. All of these things that we don't want to have to think about, like our heartbeat and our blood pressure, are all coming from our brainstem. Our brainstem also decides how much information should enter our brain. And for most of us, it's a very small amount. We take in maybe 4 to 6% of what's happening around us. Yes, we're missing over 90% of what's happening. And for that, we're grateful, because if we were taking in much more, our clothes wouldn't be resting on our skin, it would be scratching our skin. We'd feel all those tags. Food would feel weird in our mouth because we're getting too much information and our senses would get overwhelmed. Well, if you live in a traumatic environment, so if you're living in the midst of being impacted by the opioid crisis, you actually, or if you are on the autistic spectrum, that brainstem actually lets in extra information because it doesn't know what it might need to help you survive. So those kids, when they tell you the lights are too bright or the sounds are too loud, it truly is. They're hearing it very differently than the rest of us. So whenever we can soothe their senses, we actually help soothe their brain, their body, and their behavior. The next part of our hand brain is this lovely thumb here. And it's in charge of 3 really important things, which I've already named, but we're going to show where it comes from in the brain. Once again, it's called the limbic system. There will be no test on these neuroscience words. But what I would love you to remember is that it's in charge of felt safety, attachment, regulation. It spells the word FAR. Felt safety is feeling safe when you are safe, hopefully. Attachment is not just the ability to attach and love someone, but the ability to work cooperatively with others. And then regulation, which is the ability to calm ourselves. So this is the part of the brain that's most impacted by the opioid crisis, by stress, by trauma. And it's the part of the brain that is the most amenable, the most able to be regrown. So the bad news is, it's impacted by stress. The good news is we can regrow it. So when you're with the children and you're helping them feel safe, or you're helping them regulate, maybe by breathing with them or something, or you're helping them have a unique eliciting behavior, a fun way of connecting with someone, you're actually healing all parts of that limbic system. And then the final part of our hand brain is the only part we have conscious control over, which is our thinking brain. And our thinking brain, or cortex, only gets to work when our fear center gives it permission. Yes, all the new information comes in our brainstem. It goes immediately to the fear center, and in 1/14 millionth of a second, the fear center has to decide totally safe or unsafe. There's no in between. And if it decides unsafe, it takes your thinking brain offline. And guess what? When your thinking brain goes offline, first part to leave is the part you need to have a conversation. So when you're saying use your words, the children you're working with might not have their words. So how do we help them breathe first? Because that'll give them their words back. The part that leaves last is something called scripted speech. What on earth is that? That's cussing. So if they're cussing at you, please know most of their brain's already offline. This would be a good time to just do some breathing so the rest of their brain could get back online. And when the fear center goes offline, I've given you this as a resource. It wants us to do things in this order. The first thing it wants us to do is to flock towards safe others. And if we can't do that, it wants us to flee. It wants us to run away. And if we can't do that, it wants us to fight. So if you're working with a child and they're fighting, please know that means their brain is telling them it's not safe to run away or it's not safe to connect. So if you can give them something other than fighting to do with that energy, give them a place to run to instead of running from, you can help their brain calm. Or if you can give them something to hold, to get some deep pressure, they can flock and feel like they're with a safe other. And if those 3 don't work, then our brain gets us ready. And I'm going to show it down here on this one, on this slide. This is the one that I really like because the pictures tell the story. It wants us to freeze, like this man is doing, holding on to the rock. And you may get that. They may just stand there and stare at you. Please know their brain is very afraid and it has frozen them. If you just breathe with them once again, we can get all the way to their brainstem, which is the part of the brain freezing them. Or it may have you submit, like this poor woman who's caught in the current. And to submit in young children looks like curling up into the fetal position or hiding under a chair or a table or something. For some of us, it looks like repeating a behavior that we wish we didn't still use. And so whenever we can, once again, I know I'm saying breathing a lot, but breathing really does help a lot. It can calm our whole brain, which can shift our bodies, the feelings in our body, which then allows us to shift our behavior. We've done this twice already, but I want to offer you some self-care at your fingertips. If you could name 3 words that describe your strength, or 3 gratitudes like we already did. And if you touch your fingers, the touching of your fingers goes all the way to your vagus nerve. And so however you feel when you think of those 3 gratitudes, whenever you touch your fingers, it will send that calming all the way through every organ of your body. One of the groups I was training recently are some people who are working on the front line of our COVID epidemic. And one of the nurses said she was just so exhausted one day, and so many people had passed, and she was so overwhelmed that she went downstairs to hand deliver one of the tests just so she could get off the unit for a minute and take a breather. And she said, I started doing this with my fingers. I couldn't remember my 3 words, but it felt good just to touch my fingers together. And she said, before I knew it, I was actually saying a prayer, because that was some of the comfort she had put into her finger touch. So literally, when you're in the midst of things that you think, I don't know how I'm going to survive this, this is a way to help calm yourself. And another quick way are on this card, wiggle your toes left to right. Remember the sound of someone who loves you. Focus on your breath. You don't even have to change your breath. Just focus on it, and it calms your brainstem. Your brainstem's so excited you're noticing it. It calms every part of you. Whenever your out breath is longer than your in breath, it's calming. And so sometimes I imagine breathing out the stress and breathing in the calm. And here's a fun way I like to do this with the children.
Breathe. Sometimes the monster that's inside you is the monster that is mad. It's a monster who is angry. It's a monster who feels bad. When your monster wants to throw things and your monster wants to shout, there's a way to calm your monster and chill your inner monster out.
Belly breathe, gonna breathe right through it, belly breathe. This is how you do it, breathe. Gonna breathe right through it, belly breathe. This is how you do it. Put your hands on your tummy, now you're ready to begin. Put your hands on your belly and you slowly breathe in. Bubba breathe, belly, belly, bubba breathe. Belly, belly, breathe. Your belly go out and in and out. And you start to calm down without a doubt. Make your belly go in and out and out and in. Feels like himself again. Belly breathe, gonna breathe right through it, belly breathe. This is how you do it, breathe. Belly, belly, breathe. Belly, belly,
Your
breathe.
mad monster may appear at any time and any place, and that mad monster will make you make a mad monster face. He makes you want to push, he makes you want to shove. There's a way to calm that monster, bring out the monster love.
Belly breathe, gonna breathe right through it, belly breathe. This is how you do it, breathe. Gonna breathe right through it, belly breathe. This is how you do it. Belly go out and in and out. That's what belly breathing is all about. Make your belly go in and out and out and in.
And now I feel like myself again.
Belly breathe, gonna breathe right
Everybody
through it, belly
just,
breathe.
yeah.
This is how you do it,
Just
breathe.
everybody
Belly
just
breathe, breathe.
Thank you. Oh, I love that. So this is what I call the self-care keychain. I put these little cards on a keychain, carry them in my pocket, because sometimes just reaching in my pocket and knowing I have this keychain here is very calming. So when I have actually 5 minutes, I could take a 5-minute break. I have a list on my orange card of the things that help me calm if I can get just 5 minutes away. So please know that when you think you can't take 5, just like that nurse on the front line of COVID who thought, I can't step away even for 5 minutes. And then she thought, you know what? What if I walked these down to the lab? And if you think of our fear cascade, she's getting the flea response by being able to walk. She got to hand the samples to someone. That's a nice flock response, connecting with others. And then she got to do this, which was a very grounding response, which can bring her down into that freeze response and the submit response through safe calming. So when you think you can't take 5, that's when you need your 5 the most. If you get a lunch break, what's something I can do on my lunch break? So I have a card for that, because when you're on the lunch break, you don't think of it because there's so much else going on in your brain. And my favorite card is, if I get a whole day off, woo, when does that happen? What's something I can do? Just knowing that there are times in life I had to have a whole day off and I've gone hiking, makes me happy on the days that I'm not having my day off, or whatever it is you put on your final card. So I have this all on one slide for you. And then who's my safe other? Because you can call on their memory at any time throughout the day. Who's your safe person at work that you can go to and say, hey, I need to take 5. Can you cover for me for a moment? Or whatever it is. It's always nice to know who are our safe people. And just as Audre Lorde reminds us, caring for myself is not self-indulgent. It is self-preservation, especially when we're caring for ourselves as we're caring for others who are surviving the opioid epidemic and as we're all surviving a pandemic. Because if you think back on that fear cascade, what's the very first thing our brain wants us to do when it's afraid? It wants us to flock. It wants us to connect with safe others. What is the most dangerous thing we can do during this pandemic? Get too close to others. So we have to find a way to remain socially and emotionally and spiritually connected when we have to remain physically distant. So our fear center can feel safe. We can attach, we can regulate, and we can do the work that you've been called to do. Thank you so much for the work you do every day. And I hope this helps in just one small way so you can take care of yourself and remember that caring for yourself is not self-indulgent. It is self-preservation.
I do want to make sure we have time to talk about our second part. So as I said, today's a little bit different. Going forward, we'll do one didactic and then potentially break out and then do case discussion and questions. But today, just because this is kind of our kickoff and we're trying to kind of frame things for you, we're going to do a second didactic. And during this, Dr. Weber's going to give us an introduction just to the opioid epidemic and then spend a little bit of time talking about social determinants of health. What are they and how do they impact those that are, you know, all of us who are being impacted by the opioid crisis, but how do they specifically really interact with a substance use disorder? So Dr. Weber, as I said earlier, is the director of training and a psychologist at Cincinnati Children's and is involved with their University Center of Excellence in Developmental Disabilities and in their Leadership Education and Neurodevelopmental Disabilities program. So without further ado, I'm going to turn it over to Dr. Weber. Thank you, Dr. Weber.
Thank you, Dr. Whitwer. So as she mentioned, I will be talking about the opioid epidemic, kind of some basic history, as well as social determinants of health. So, all right, I have nothing to disclose at this time. And as we've talked about all day, as we start to get through the material related to Project Scope and supporting these children, we always want you to be mindful, take care of yourself and others. We know that Ohio has been incredibly impacted, and it's likely that you have someone that is a colleague, a friend, or a family member who has been impacted by substance use disorders. And so we want to make sure that you're taking care of yourself. And so that may mean you take a break and walk away, or go get a drink of water, or close your eyes for a few minutes. So we understand, and we want you to just be able to join us for as much as you can. So our objectives for this part are to understand the development and history of the opioid crisis in the US and in Ohio, to understand social determinants and how they impact health and well-being in general, to describe determinants that are impacting populations specifically related to the opioid epidemic, and to discuss some stigma related to substance use disorder. So we have to understand, and I think Mary did a wonderful job emphasizing the pandemic. But before we even got into COVID-19 pandemic, we were already living in an opioid epidemic in the United States. Opioids, by definition, are the medications that are prescribed to work on the brain and the spinal cord to reduce one's perception of pain. They can activate the reward center of the brain and create a sense of high or a euphoric feeling for the patient. When we think about an epidemic from a public health perspective, and we've heard a lot from our public health experts throughout the pandemic, the epidemic is an increase, which is often sudden, in the number of cases. And by cases, we mean the number of impacted individuals that a disease would influence above and beyond what is normally expected in that population. So we know that opioids in the United States have reached the epidemic level. I'll also mention that moving forward, we will try to use the term substance use disorder versus addiction as much as possible, given that it is more person first language and also recognizes the medical contributions, and that substance use disorder really is a medical condition. Some common opioid names that you might hear are codeine, morphine, methadone, oxycodone or OxyContin or Percocet, hydrocodone or Vicodin, buprenorphine or fentanyl. And again, these are all prescribed by licensed professionals. Other names that you hear of non-prescriptions that are potentially more like street drugs or synthetic opioids include heroin, fentanyl, and carfentanil. We know that opioids in America are the leading cause of accidental overdose deaths. And we lose over 130 lives per day in our country due to opioid overdoses. 11.4 million people a year misuse prescription opioids. And just think about that. That is the population of our state of Ohio. So the numbers are really astounding. This is what we call a heat map. And this gives us an idea of where the problem lies the greatest compared to other areas. The gray sections, those states are where data is not collected for this measure. And the lightest pink is where it's the least impactful. And unfortunately here in Ohio and in West Virginia and Maryland and some eastern states, we are being hit the hardest. So we are the darkest red, where opioid involved overdose deaths are over 27 per 100,000 people. So we have an incredibly high rate and a lot of work to do. So many wonder, how did we get here? How did it become an epidemic? Opioid prescriptions were initially prescribed for acute therapies, so things like after surgery or after an accident. And in the 80s and 90s, they were expanded to chronic therapies, so for chronic back pain and alike. Additionally, in 1989, the National Institutes of Health came out with a statement that opioids were, quote, not addictive. However, given all the research and studies we've done since then, we know that this is completely untrue. Additionally, in the 90s, insurance companies reduced payment for non-medication or non-medical treatments for pain. So things like therapy, talk therapy, were not covered because it was deemed that opioids were the gold standard. Additionally, the healthcare systems started adding pain as the fifth vital sign. So when a patient would go into the doctor, they'd get their temperature taken, their pulse, respiration rate, and blood pressure. And then anyone that's been a patient recently, you might see something like this, a pain assessment, where you would rate your pain on these colored faces. And ultimately for healthcare, the goal was to reduce pain altogether for patients. So it came from a place of good and a place of do no harm. However, what we know is that opioid use can quickly lead to opioid use disorder. Initially, patients take the medication to feel good, to reduce pain, but over time, their tolerance builds, and they have to take more of that opioid to feel the same relief. And then over time, when use reaches the disorder status, people really begin taking the opioids just to not feel sick, and no longer are they used to feel good or reduce pain, but it's just to get through their day. Risk factors for substance use disorder are well studied, and what we know, and I really want to highlight given the global pandemic that we're living under, is poverty and unemployment are two of the main risk factors. These are not going away, and in Ohio, the unemployment rate peaked early in the pandemic at around 14% and is still holding steady at about 11%. So we really have to be mindful of that. Even though we're faced with all of these dilemmas and difficulties related to the pandemic, we also are being faced with these risk factors due to the stressful circumstances, and that will lead to additional substance use disorder. Unfortunately, we know through the media that opioid overdose deaths are highly common. And in 2018, we lost 46,802 American lives to the opioid epidemic. We also know that opioids are the most used substance, and that 69% of all overdose deaths are related to them. How does this play out in our work with families and children? Opioid use disorder, women in pregnancy, is really important to understand the history. We know that about 1 in 3 women that are of reproductive age filled an opioid prescription each year between 2008 and 2012. Additionally, at the turn of the century, 14 to 22% of women filled an opioid prescription during their pregnancy. And what's to be noted here is that these women started by getting a prescription from a trusted physician or healthcare provider. So in their minds, many times, these were safe for them. Additionally, maternal opioid use disorder has more than quadrupled since 1999 in our country. And we know that out of every 1,000 babies delivered at a hospital, more than 6 were to mothers experiencing opioid use disorder. Specifically in our state of Ohio, we recognize that the history starts in many of our Appalachian counties where poverty and unemployment are incredibly high to begin with. Portsmouth, Ohio, and the surrounding counties were incredibly hard hit by opioid crisis and prescriptions in the mid-1990s. Additionally, the first adolescent with opioid addiction was treated at our Nationwide Children's Hospital, where our colleagues work in Columbus. In Ohio, our opioid overdose deaths peaked in 2017 at 4,293 and dropped slightly in 2018 to a little over 3,200. Heroin-specific involved deaths peaked in 2017 at 1,000 and dropped to 721 in 2018. Some other demographic characteristics about opioids in Ohio: as I mentioned, 3,200 lives were lost in 2018. Men are 2 times more likely to die of overdose, and more than half of those who die of overdose are in the age range of 25 to 44. 84% are white, non-Hispanic, and we know that synthetic opioids lead to 68% of overdose deaths, so things like fentanyl and carfentanil. Now I'm going to change gears and talk about social determinants of health. And I have about 9 minutes to cover a lot of information, so we'll probably skip through a video. But I want to make sure to mention that prescribing is a single causative factor in the U.S. overdose crisis, which means that prescriptions have shown to be causing the overdose issue in our country. Social determinants are really the factors outside of the individual's control. So these are beyond their genetic makeup and their individual behaviors. They could be things like individual resources, such as socioeconomic status and financial stability, neighborhood characteristics, such as does one live in a food desert or a place where there's no healthy produce and grocery stores? Community, and this could be related to availability of rec centers and community activities for children. Additionally, hazards and toxic exposures. And really, when we think about toxic exposures for our children, we're going to spend a lot of time later in this series talking about trauma as an adverse childhood experience. And then opportunity structures. And opportunities could be related to quality education and childcare. Social determinants, according to the CDC, are where we live, learn, work, and play. And these can all have a bigger impact on how long and and what our quality of life looks like, even more so than medical care. And a person's chances of becoming sick and dying early are influenced by these factors such as education, income, housing, and the quality of neighborhoods. Additionally, I want to make sure everyone is aware that zip code matters greatly. Down here in Cincinnati, where I live, there is a 20-year life expectancy difference between the wealthiest zip codes and the poorest zip codes. And these things, I'm going to skip that video for now, but these things are incredibly avoidable. And they really are the systemic differences in health that are unfair and truly matters of social justice. We've heard a lot about systemic racism and racial injustice in our country, and this also plays out in the healthcare system. Health inequity leads to high health disparities. And these are basically when we have higher numbers of illness, injury, or disability and death by one group more so than another. And we always think about the fact that research supports lower income, lower education, minority groups, and those with disabilities have poorer health outcomes. So what can we do about it? Because we can make our individual decisions and individual strategies and all work together to help prevent and help improve the lives of individuals experiencing substance use disorder. A lot of the prevention has to do with educating prescribers, as well as what we can do around decreasing stigma and encouraging individuals to seek out substance treatment and mental health treatment. Additionally, we can talk through systems level changes such as increasing livable wage, improving quality of education, providing for affordable childcare, which I know is very important to many of you on the screen, and providing for food security for some of our most vulnerable groups. So in closing, how can you make a difference? Well, the theme of today is take care of yourself. We can't do anything without putting on that oxygen mask first. Additionally, work hard to destigmatize substance use disorder and addiction in your lives, both personally and professionally. Finally, we want to also consider how the social determinants that we talked about today can impact the children that you know, that you work with, or that you care for. And then we'd love to have you join us in 2 weeks on August 21st with our next session on toxic neurodevelopment and neonatal abstinence syndrome, and keep this strong community going so we can generate ideas and teach each other about strategies. We'd also love for you to present a case, and I'll talk about this more in a moment. I will end just by this quote from the late John Lewis, who recently passed. If not us, then who? If not now, then when? So to provide a case study overview and really kind of sell it and sizzle it for you all, it's very simple. We would love for you to reach out to Jessie Thomas, and she has provided her email multiple times in the chat box, and she's the one that's been sending you your information. And you would just fill out the template and include a difficult situation that you might be experiencing or just something that you think has been interesting in your work. So in this case, we might do a case related to social determinants, stigma, provider self-care. You would provide us with the age of the child or the family member, and in this case, it could be a 26-year-old mother and her 2-year-old male child. And the setting would be early Head Start. The primary concern is that the child is biting and the mother appears overwhelmed, and whenever the provider talks to her, she shuts down emotionally. His triggers are that when he cannot get his way, he'll bite peers and adults. Strategies include telling the child no, and then we can talk through if those strategies are successful or not. And then you would provide the group with 2 or 3 questions that you would want answered, and that could be, how do I best manage this child? Or how do I work on addressing the mother's mental health needs? Additionally, we always want to think about how our professionals, which are you, are well equipped to successfully accommodate the needs. And all of this is kept de-identified. And so it's really just a good opportunity for us to teach each other and learn from each other, and especially connect to a professional network across the state. So here are some resources from the talk today that will be available in the slides, and acknowledgements for our funding agencies and the universities that support us. And then there are some references for you.